So we'll go ahead and get started. This is the Tuesday, April 20th COVID-19 Response Committee meeting. It's 4:30 p.m. I'm Chairman Jesse Letterman. I'm joined by my colleagues, City Councilor Tim Allen and City Councilor Tracy Whitfield. And we are also joined by the Commissioner of Health and Human Services, Commissioner Helen Colton Harris. It has been a couple of weeks since our last meeting, but we've all had some different opportunities to engage with the response in various ways, and I'm very appreciative of the Commissioner for her continued work and the work of her office. So I think probably we can begin by receiving her update and posing any questions for the Commissioner. So at this time, I will hand things over to Commissioner Colton Harris.
Thank you, Councilor Letterman, Councilor Allen, as well as Councilor Whitfield for being here. I am going to not be long-winded. The data that I provide is up on the city's website. It has been posted, and I'm happy to send it to you independent of that if you'd like. But I will hit some of the highlights of the data. The data for the city of Springfield is really representing how just pervasive this virus is amongst our younger population. 57% of the individuals who received a COVID-19 diagnosis last week were under the age of 30, and 27% were between 31 and 50. And that means that 85% of the cases in the city of Springfield last week were under the age of 50. And so what we know is that this is becoming, again, a virus that is impacting younger people. Also, we know that the hospitalization rates of younger people is also something that the hospitals are currently dealing with. It is the belief that it is the new variants that are more transmissible that is having an impact on our students as well as our 31 to 50-year-old age group. I think what's interesting is that the 15%, 51 and older, is the group that has been vaccinated. And we are seeing that deaths in nursing homes are significantly down. And so what that tells us is that the virus, while it's obviously a lot of community spread, our vaccines are working. And I think that's good news for those individuals in nursing homes and people over the age of 51. So 85% of our cases under the age of 50. The cases by race, unknown, 26%, other, 27%, Black, African-American, 18%, and white, 28%. As I was saying to Councilor Whitfield, it's come to my attention that there's an institution that is telling their students to put down other rather than the accurate race. And so that skews the data. And I will be, I'm working to try and scrub that so that next week I can have a more accurate count. The zip codes data is really, you can see where we have institutions of higher learning, that zip code is really represented, has the highest number of cases. So in zip code 01, there were 2 cases, 03, 5, 04, 100, 05, 38, 07, 30, 08, 80, 09, 140, 18, 46, 19, 36, 28, 4, 29, 24, and 51, 43. So again, those the increase in cases can be found in our institutions of higher learning. I will tell you that each one of those institutions are in 09, as you know. All of them happen to be represented in that zip code. The number of cases to date is 1,278 for the month of April. This week, we are doing today, we did St. John's Congregational Church, second doses. South End Community Center is Thursday, second doses. Harena is Friday, second doses. Bolin, Saturday, second doses. Interfaith, there will be the Interfaith Community Clinic that will be held this Saturday at St. John's Congregational Church. There are 11 pastors who have come together under the VaxForce community initiative, and they are signing up the individuals in their church community, but we will be opening that clinic up to other members of the community, I believe. Those are going to be first doses. We did not do Ray Jordan this week. We had that Tuesday tonight and Thursday we did not do because of the number of doses that we have on hand, which is 1,300. The Commonwealth does not provide us extra doses when we're doing second doses, if that makes sense. So whatever doses I get, and it's a heavy second dose week this week, those doses had to be used for the second doses. And I wanted to make sure we had vaccine for that interfaith community, that interfaith clinic on Saturday. AMR has-
Hi, Alex. We know from Nassau County Police, they have deployed 150.
Sorry.
AMR has tested 183,288. Springfield residents have been 81,114. Positives have been 16,884. And I will just end with Springfield Public Schools. There are 85 clerks, SEA 2,341, para 647, nurses 59, administrators 75, principals 56, custodial 203. That's the number of staff that's in the schools right now, for a total of 3,466. And you may have read the report that said that we that we were the highest amongst school positives from April 12th to April 15th. And it's important to acknowledge that only 32 of those cases were Springfield public school students that are in person. 17 of those cases, 17 additional were remote. And amongst the teachers, only 8 staff were positive. I should say right now there are 7,504 students in the classroom. And I point that out only to say that it's a very low number when you look globally at the numbers. And I've heard from a lot of parents who just by that article really thought that there was a lot of virus circulating in Springfield Public Schools. And based on the data, that's not the case. The staff is 0.23 for positives, and the students are 0.42. So not even a percent, not a quarter of percent, not even a 0.5% are impacted by the positivity rate. So, and our deaths remained at 239. And so I'll end there and ask if you have any questions for me.
Thank you very much, Commissioner. Certainly we can take some questions. I want to say, first, thank you for all of your work. I had the chance to visit the Ray Jordan Center last week, which is, the latest in the clinics that I've had a chance to tour, and just great to see folks turning out, and also the volunteers, the students from the pharmacy school, retired physicians, public health nurses, Springfield Public Schools nurses, and of course, AMR. And I see Councilor Whitfield has just indicated she has to depart, and looks like she has departed at this time. But a couple of questions on my end, and then we can see Councilor Allen if you have any questions. Relative to the data for vaccination, I know we're now able to get the zip code data. I've looked at it myself. Are we analyzing that data at this time in any particular fashion as it comes out, as it pertains to the zip codes and other demographics in the city?
That data is available, as you know, it's online, and they do break it out by zip codes. And we are analyzing it. The question becomes, and I think I said this before, looking at that data, you really also have to look at the population base in that zip code so you can come up with an accurate number as far as the penetration of vaccine in that zip code is concerned. So yes, someone is doing that work. It's ongoing. I had wanted to publish it, but it changes so quickly for the city of Springfield. But yes, Councilor, we are looking at that data. But again, we have to use the population base of that zip code as the base for creating a data portal around the penetration. The other thing, I'm working with ED Ready, which is a data analysis group, to just really do a better job, or at least do a more thorough job at looking at more components of our data and how it can inform us on how we move forward with our vaccination clinics and our testing.
Yes, certainly. And I think that's the real question. I mean, certainly we can look at it high level, ourselves, but being able to see that analysis with the population density, I think is really important. Perhaps maybe for next week, if possible, if we might be able to get a snapshot of that, if it's available, not necessarily needing additional effort, but if it's available. I think last time I had looked, we were just over, looked like we were just over 20,000 fully vaccinated, but that was last week. Do you know an updated number?
I believe it's 23,000 fully vaccinated, and that number should go up. And I say 23,000. That's a broad number. It may be 23,101. But that's the base that I was looking at. So this week, Bay State, and I'm only going by what I know Bay State and Mercy did and we did as far as fully vaccinated are concerned. And I'm just adding that to what we already have. So it's not a drill down as far as DPH is concerned. It really is trying to get some sense of our own data and, how many fully vaccinated people there are in the city.
Certainly. Councilor Allen, did you have any additional questions for the commissioner?
Well, my only question was on Springfield, and I think that's what you just answered, right? 23,000 people fully vaccinated.
And
out
again,
of 100.
that was taking. And then another thing about that, when you look at that 23,000, you have to remember that there were only a certain number of people until yesterday that were able to get vaccinated. So that 23,000 has to be thought of against the total population of eligible individuals in our city who are able to get vaccinated. So it's going to take a little work, I think, to really get there, and a little time. But I just added what I know from Bay State Mercy and what we did.
Thank you. Do you know how many students, do you know what the population of Springfield is below the age of 16?
I do not.
That's the group that is not eligible, right?
That's correct. But Moderna is 18 and over, Pfizer 16 and over. So again, you have to look at the vaccination in that two groups. So 16 to 18 can get Pfizer, but over 18 is Moderna. And the J&J really, the J&J concerns have created a talking point for anti-vaxxers. It has also created a real challenge with people who are saying, see, I told you so, or see, and so we're starting to find, even trying to organize this faith event, you understand that there is some hesitancy, there is some resistance, and people are just not ready. And a part of that has to do, I think, with some concerns. We are in the process of developing a survey that we will administer, because we'd like to know how has the J&J, how has that impacted your decision making?
Thank you. That was my only question. Thank you.
Thank you, Councilor Allen. Commissioner, with the new eligibility, presumably, have we got any indication that the state plans to make any changes to our allotted doses locally. I mean, I certainly hope we're not hearing that they plan to decrease them, but have we heard any indication that in the future they may plan to increase them?
I did not, and that would be, we are looking to open up 4 new sites, as I think you know, the J.C. Williams Center, the Greek Cultural Center. Bay State has said that we can use their Brightwood Health Center as well as Mason Square. We also will want to keep Ray Jordan in place. And I only say that to say that I think we are prepared to do more neighborhood clinics, and that is definitely going to depend on allocation of doses. If that doesn't happen in a timely way after I make the request, I will be coming to you, as well as the mayor, obviously, for support around making sure that we get additional doses, because Hampden County, I believe, is lagging in fully dosed individuals, and certainly Springfield, I believe, is as well.
And I think that's key too. I think for us to, when we look at that data analysis, to also be able to compare with other communities across the Commonwealth, if we have to make that argument. I'm hopeful, but we will certainly be here for you, Commissioner, should you need additional assistance in advocating and lobbying around those doses. I mean, I think we can show very clearly that once the doses were put under your control, the numbers significantly have increased in the city of Springfield in terms of vaccination. And that's really what I think we've all been saying from the beginning, you know, is allow the local administrations and communities to really do the work. I did want to say too, as we consider the rollout, and I know there's some funding coming in from the federal government, in terms of the continued efforts of the Vax Force, I heard really wonderful things from folks about the Harena site earlier this year, and how many people were reached through the door-to-door that was done by some of the community organizations. I think that's a great model. And so I hope we might be able to have some funding for that type of community outreach in place to see that happen around those other sites.
You will see the city of Springfield's media drops start to hit the airwaves, and we did not just do it on local channels. We really tapped into what are those channels that young people watch. What are those? How can we just influence in a way by using media, social media, and we are going to do that. They should start dropping tomorrow, actually. So yeah, it's really, really important that we get the word out, and outreach door to door. Definitely, New North Citizens Council did an excellent job with that. And not only did they do an excellent job with that, and I'm sure there were others in the community. Let me not just say, I'm sure there were others, but that's the organization that showed up at the clinic, that was there with giveaways and making sure that Spanish language was absolutely covered. So we've got great partnerships in the city.
I think that's definitely a model to follow, Commissioner. And I think we just need to continue to also, and for anybody who might be watching or watching later, encouraging folks also to utilize what is available at the state level in terms of being pre-registered. I pre-registered several months ago, filled out where my categories were, and received a text on Sunday that an appointment was available at the Eastfield Mall. So I'll be getting my first dose at the Eastfield Mall this Saturday, and was able to register. So, it does work. We need folks to continue to follow through in terms of booking the appointments. So I think, Councilor, I think you're the only one still on here. Do you have any additional questions for the Commissioner, or Commissioner, do you have any additional asks or questions?
I'm good. Thank you very much.
I'm all set, Jesse. Thank you, Alan.
Yeah.
Thanks, Jesse.
Thank
All
you.
right, I'll just let you both know I am with the Commissioner's contact. We are reaching out at Councilor Curran's request about the at-home vaccinations that are being done through Commonwealth Care Alliance. So we hope to have one of their representatives in the near future, and we will reconvene next week, same time, 4:30 on Tuesday.